Venture. अभी possibly front bencher. पुढे करता है. क्या था?
I'm going to talk only on blank slate. As long as you know so internet and Excel. Exactly. Saturday meeting. Sir, I can say whatever I want. No, Saturday meeting has Saturday go. By the way, and he is going. No. He's coming. No. He is coming. He is going to standing and we will be asking a question. He was. Short case. Conventional radiology. Just excellent. Recording study. Even Abhijit will ask questions पूछने को आना चाहिए. Answer नहीं मालूम. Exactly. The teacher need not know the answer. Homework बोल रही. Ready? Jumps from values. Please. Apologies, class, please keep quiet. First of all, apologies for being late, and there's a very good reason because we have a brand new audio video system, and we're just setting up. And I was a guinea pig lecturer for getting this okay. Manish Srivatsava, some of you know him. Full trouble from the beginning. From our resident, he's saying you're showing only the blank slide for the whole lecture or what? What to tell him anyway. So we'll start with the presentation now with profound apologies for being late. I'll get used to this. This guy is something to do with basketball for sure. And he is too old to be a player. And when you are too old to do anything like me, you become a coach or a teacher. So he is the coach of the University of California at Los Angeles basketball team. And he is supposed to be a legend. He was a legend in his lifetime. Because he is not only a basketball coach, but he is one who values human, who has great human values, even on the court, off the court, which is very unusual in the NBA games today. And his name is John Wooden. if you look up the internet on John Wooden, you will have game hardened, season hardened basketball players crying when they talk of him as their father. In that sense, this man who has come from a rural background, I think in southern United States, has been taught values by his father, and he lives with those values. And much of what he has been is in his talk, which is called The Difference Between Winning and Succeeding. Now, during the course of this talk, I'm going to ask you to do things, to read something, to watch something, and that is simply because these are uh, events that have shaped my life. Watching this program, watching what he has to say, has made a huge difference to me. The way I play on the game, on the court, I do that very, not very often, off and on, and how I conduct our team players, the youngsters, to be on the court, off the court. That's expected. He's a basketballer. Things will happen on the basketball court. But what he has said in the course of his talks, and this particular talk, which is just an 18-minute talk, and I will implore all of you to please watch this, and you'll get a link to this on the end of at the end of my talk. So he talks of many things in his game, and one of the things he has said, what's happening? Yeah, is about this lady, young lady, a teacher in the United States, again in Vermont, I think, and her name is here, Glennis Harmon. And she has this now very popular poem, which is called They Ask Me Why I Teach. And I reply. So the title of my talk is borrowed from this poem, and you will get a link towards the end of the talk to this full poem, and I will then tell you what to do with that poem. Now, therefore, everything that I have said, will say now, is dependent upon what has happened so far in the field of education, both on the court and off the court. Let's think of the life of a radiologist as on the court. What you do in the hospital, what you do with patients, what you do with education, exams, and so on. Now, what happens is that when you are so used to something for so long, for decades, for example, life like I have been 1980 to now, you stop thinking of what you are dealing with. It happened once that a visitor came to the hospital and she said the first thing that this hospital needs is a coat of paint. So when you're in a hospital which has no coats of paint, you stop noticing that. So when I have been with students for so many years, I stopped looking at them as where do you come from? And something happened, it's a long story, and I said, let me see how these youngsters become doctors and then come to me as people who want to become specialists in radiology. And it goes back a long way. And that is perhaps the most important part of the talk that I'm going to do about teaching. What happens is this. Before they are born, as if they have play groups, then they have junior KG, and they have senior KG, which is not bad. I didn't go to any of these. I went to first standard at the age of 6. There is nothing wrong with me, I think at least. So they go through this, and each of them has an entrance test. And I know this because I went with my son for playgroup, and he just cried, cried, cried. He went to junior KG, he cried, 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 and he went to senior KG, he cried, 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 so on and so forth. So you go with a child, and there is tension in the air. The child is crying, not all of them do, but the parents don't sleep. There are, this you'll hear again and again, hourless days and sleepless nights. This is how it starts, first for the parents, and then they get into school, and then see what happens. By age standard, I think I'm told that they start preparing for their life, which may either be engineering, as it was in the case of my son, or maybe medical. So you start life
with competition, which you don't understand, your parents understand. But by the time you're 8th standard, there is so much pressure. We used to call helicopter mothers. Now I call drone fathers. Both of them are sitting on the bachu's head and saying, you do this, you do that, and the child is going mad. Let me do what I want to do. Let me do what I want to do, which is not an option for most children. The parents decide that he becomes an engineer or a doctor, and now, of course, there are so many other options available. But I will restrict myself to what happens to them when they want to become doctors. By 8th standard, they are in coaching classes. For my son, I think it was 9th standard or whatever. And by the time they get out of school, which is 10th grade, 11th grade, they have gone through multiple coaching classes or have had tuitions at home. All that they know is compete, compete, compete. You have to be better than the next guy. Whereas Coach Wooden has said very categorically in his lecture just the opposite. Please watch that program and you will know why he has said what he has said. He has said, do not try to be better than anybody else, but do the best that you are capable of. That's what he tells his coaches, his players, which is also true in the era of competition. But students, they'll say, Ravi sir is talking madly. How can we live like that? Our job is only one-fold. What's that? We want to be better than the next guy, otherwise we lose all our opportunities. May be true. So they go through this, I want to call this undergraduate NEET. What's the fun? Some of them will get into medical school. A large number will not go into medical school. Luckily, if the Supreme Court doesn't intervene, everything goes well. And when they come into medical school, I do not know if all of you are aware of the huge tragedy that is happening here in our own hospital. When they enter the clinical terms, and I know this on authority, they do not go to the wards. They do not examine patients. They do not write notes of examination of patients. Sometimes they go to operation rooms, maybe to the OPDs, and everybody is happy. Students don't go, teachers don't teach because there are no students. And I wonder what will happen to the generation which is immediately senior to these bachu log. Who's going to take care of them? These are bachus who want to be swimmers without getting into the swimming pool. But the reason for that is they are not interested in this. They are interested in the PGCET. They are sitting in the library, they are sitting in the hostel rooms, and they are trying to solve papers for PGCET. That PGCET happens sooner or later. And if the Supreme Court doesn't intervene, results come out on time, and then you have this. You can imagine the hourless days and the sleepless nights, and you've seen the results of these exams, these classes, suicides, attempted suicides, parents and children getting apart from each other. This is the tragedy of modern competition. I don't want to get into what are the options and etc., but this is the reality. They go through hell to be getting into postgraduate education. And what happens then is this. Some of you may have done this. Now probably you're sitting at home looking at the computer. I remember doing this for my son's engineering CET. Early morning, I think it was 2:30 or something, the three of us sitting there and looking at his rank. Tension in the air. Life is at risk, as if. So these bachus go through this. Look at this. This will happen. Some will get in, many will not get it. And these are the bachus who get into postgraduate medicine, who will come to me wanting to do radiology. Some of them will come and say, we want to do radiology. And this is what happens. And many of you here have gone through that. Now, when I think of this whole scenario from junior KG coming up to radiology, say, or surgery, or whatever you want to think, and the thing that these children go through, and I enumerated all of that, it's not just the children, the whole family suffers. The neighborhood suffers. Mummies are talking on the lawn. How much mark did you get? How much mark? How can you get 1 mark more than me? That starts with mummies. Maybe fathers too. So they have gone through hell. And I am reminded of my hero. He is my hero, George Wald. The man on your right who is balding, or is it? Yeah, on the right is George Wald. George Wald is professor of biology at Harvard, and he was given the Nobel Prize in 1967 or something for describing the biochemistry of vision and the role of vitamin A. For those of you who are interested and nothing better to do in life, you should watch or listen to his Nobel lecture on the biochemistry of vision and how hard they work, where all they go to get into the biochemistry. But again, that is not the reason he is here. He is here because of this. Something going on here. Okay, now there's some commercial coming up now. It's okay. What can I do? So this is what his students say. His students have jam-packed the hall, 600 students. There is no standing place. And many of them will say this. He isn't really teaching, he's inspiring. I don't read my slides, I'm reading this because this is so profoundly said across the internet that this man is a teacher par excellence. And he has this book called The Origin of Death, not the origin of life. Every donkey has written about the origin of life, but no one has written about the origin of death. And while in this book, now this is interesting, I'm going to spend a minute on this. I read this book when I was in first MBBS. Something happened and I got to read this book. It's a small 30-40 page monograph. I read it first in 1971, and since that time I've also read it 25 other times because it's freely available on the internet. Now, in the course of this book, The Origin of Death, there's a lot of humor. It's fun to read that book, but Wald has talked about the salmons. The west coast of the US, these salmons do some funny things. What they do is that after being born somewhere, they flow down the rivers there into the Pacific Ocean. They do all sorts of things, grow up in the Pacific Ocean, and when it is time for them to go and reproduce, they do the rivers. They climb up across, against the tide. And when they do that, there are stones, they get cut all over the place. The bears are waiting for it. The canning industry is waiting for it. The bear is teaching her children how to catch these fish, just like we teach our children, students, how to pass a Ryle tube or do a pleural tap or a lumbar puncture. After doing all of this, escaping all of this, they will go to the spawning ground back where they came from, and they will end their life. They will lay their eggs, end their life. Now, somehow, this type of compulsive behavior, this is a compulsive biologically driven behavior. Why should they do this? They go down and they come up and go to the spawning ground. It's like what our children do, what we do to our children, compulsive. They have to become this, they have to do this, they can't do this, and children go through hell. And it is those children, just like these lemmings, that come to us for radiology. Now, radiology has very intelligent people. The top of the top in the NEET exams for whatever reason. And then when I meet them, when I sort of like for example, Manish, for example. So when I tell him that radiology residents are very intelligent people, he says, yes, sir, we are very intelligent people. And then comes the fun part of it. Rima is saying, yeah, you told us also, no? So, when Bachus hear this now, they go aghast. What does Ravi think of? No, Ravi sir think of himself. How can he say this to us? It all happens behind my back, and I'm aware of it. But what I mean is something that I'll try to elaborate later on. But this is what they are. They have come through killing competition. And I call them, I think there is one, no. So I call them tick where applicable generation. That's all that they have done. If you tell them, is today Thursday? They say, we don't know. Then you tell them, is it Wednesday, Thursday or Friday? They'll tick Thursday. They have been conditioned like that, unfortunately. It's not their fault. It's the fault of the system. And we don't know how to improve the system. Again, another top thing altogether. Now they come to me like this. Uh, this must have been about 100 years ago. Look at that. I have some black hair on my head. So they come to me like this, 6, 7. Now I think much larger numbers come. And when I say them like this is Sanskrit. Shishyaseham Shadimam. We are our students, teachers. Abhijit Rawat says, my mother knows Sanskrit. This means, how can they say Shadimam like this? It's not Shadi, it's Shadimam. Now, this comes from the Bhagavad Gita. Arjun tells Krishna on the battlefield of Kurukshetra, when he sees everybody again, I mean, all big people, he says, teach me what to do. And then there is one beautiful word after this, and that is this, prapannam. Now, there are some words in our own culture, like, for example, seva. What is the word for seva in English? You can have multiple words, but no word conveys the thought of seva in the sense that, say, Gandhiji meant. So prapannam is a word like that. It simply means teach me the right things to do in life. So these bachus as if do this to us. They come, they are thoughtful, and they are thinking what's going to happen to us in the next 3 weeks, so on, 3 months, 3 years, so on, and so forth. So when this happens, then I talk to them. I talk to them for 15, 20, 30 minutes, maybe. But this is a talk I talk every single time till I was the head of department here and sometimes for some time in the Kokela Bain Hospital. And I tell them many things. And where do I, the next few slides will tell them, will show you why I tell them, what I tell them. And the reason I tell them is because I come from that culture. My teachers, both undergraduate and especially postgraduates, have instilled some values. Dr. Nadkarni is here somewhere. Yeah, she's there. Those values remain with you and they get transmitted to the next generation. And these are some of the things that I will every time tell my bachu log. And I'm very happy to learn that when they come back to me 15, 20, 30 years later, they would say, those were inspirational words that changed my attitude towards radiology. At least some of it is true. This is feedback. They don't have to say that. They don't have to come from US or UK and say, sir, you said this, and that was inspirational, so on and so forth. It's not required. But they say that this has happened to them. Not all of them, some of them. Some of them must be saying, "Ek bakwas hai, kaam nanda nahi hai, Ravi sir ko." But this is one of them. This is important. The concept of ownership. This is your department from today. And I can assure you that it is no one so far has done something to make me feel wrong, that I should not give so much bow to my residents. It has never happened so far. The other thing, I'm very particular, extremely particular that they be on time. Not because it's a habit because people are waiting for them. There are patients who are starving overnight waiting for them. There are patients who are taken enemas waiting for them. There are patients who have IV lines going on them. There are patients who lose their job if they don't go back at 11 o'clock. This is something that we have to instill in all our children, all our students, that be on time. That's okay. The other thing which is more difficult is that if you are late, you have to apologize to the patient. I'm sorry, I'm late. That's another thing I tell them. I don't know if they follow it or not, but be on time always is something very important. Now the question is this, why am I telling you all this? If you ask my bachu log now, they will say, ask Manu, she is the best critic of Ravi RAMAKANTAN. Ravi sir has this strong habit of talking unwanted things in a lecture and do time pass. He will never talk on the subject, but you will realize that this is a part of education, of the teacher and the taught. And this is something very simple. Never lie or cheat. And there is never need to do so. That's important. If you did something wrong, you don't know the value of serum creatinine or you don't know what happened to the patient, you have no follow-up, simply say, I don't know. That's fine. You can say, I don't know once, twice, 3 times. If you say 10 times, you're out. I don't know is allowed. And that's something that I make clear to the Bachu log. And the last line is very interesting. And some of you must have heard it. No matter how hard you try, you cannot cheat yourself. The trouble with this line is that I myself get confused. What the hell is this supposed to mean? But you get a sense of what it is supposed to mean, that lying, cheating, whatever it is, when it is not required, you're not benefiting anybody. And the whole bottom line of all this is this: the doctor-patient relationship is based on trust, nothing else. It may become AI a little later, but it is based on trust. And therefore, the student-teacher relationship is also based on trust. You violate one, you're likely to violate the other. And it generally happens, as far as I can see, that a large majority of students will not go back on this. A large majority don't do that. Some here and there may be doing time pass, but that cannot be helped. And of all the things that I tell them, I think the last line is the most important. You have to remember that these days, students come from all over the country. They have no one here. They don't know the language. They have no support. They may be harassed in the hostels. Therefore, they need not only educational support, but they also need emotional support. I can think of at least half a dozen cases, both in KEM and a couple in Kokilaben, where they have come to us, to me, to other faculty, asking for help. And being moral support to them is paramount, or is of paramount importance. Lives change, and they will forever be grateful to you because you were there with them when their parents were not there, where there was no one there, and you supported them. This is important. Imagine your own son or daughter going to another city in an unknown place, not knowing a language, with no one to support. How would they feel? So if you are a teacher of postgraduate students who are going to be with you in the department all the time, this is something that you have to assure them. Welcome, ma'am. I was just saying that it's so important to be on time. Sorry? Yeah, that's right. Okay. Because she knows Ravi sir talks about cost. Anyway, so this is important. They have no one here. Now we can now have a system of support. There are people appointed in the hostel. There are people in the hospital. We act as their mentors. So that helps them take care of all of this. The other thing that I ask them to do is to ask why for everything. When you are a tick where applicable generation, you stopped asking why. All that you know that if the question looks like this, the number 3 is the right answer. And this is important because remember, in KEM radiology, we get the best brains. Top of the top, maybe AIMS comes there, but the top 5% come to KEM radiology. And if we cannot make them into good researchers, then the fault is ours, not the student's fault. I keep telling them, you're IIT brain, what the hell, what are we doing with you? So this is something that will happen only if they start asking why for everything. If, for example, I keep this classical example, why is there a superior oblique in the orbit? And why is the superior oblique so different from the inferior oblique, which is a sheet of muscle? The superior oblique has a tendon, it goes through the pulley. Why? The rest of it is very complicated. At least why are there oblique muscles in the orbit? There are many things that like that. How is the gluteal fat oriented? How is the heel fat oriented? The answer, Srinivas, on your knees.
Say thanks.
Parenthetically, I said I'm not thanking you for coming. Anyway, Srinivas and I go back a long way. Long way means what? We work together and it troubled me a lot. So this is important. Inculcate the habit of asking why for every single thing. It may sound stupid, but they have to know why. Why should the nasogastric tube should be here and not here? Why is it not enough for the nasogastric tube to be just within the stomach? And inculcate in them the habit of working in vitro, doing experiments, and asking why. I mean, this is of great importance. If the teachers don't do that, who will do that? This is another one of my admonitions to them, that images are just images. But do not ever forget that behind a patient, every image, there is a patient. Imagine now. I wonder how these ultrasonologists manage that. They're doing a scan on a woman who is, say, let's say, 12 weeks or whatever pregnant, and they find no heartbeat. How do you tell the mother that your child is dead? Or you do a mammogram on a lady and you find that there is carcinoma which is invading. How do you tell a woman that you have breast carcinoma? I mean, these are two examples that come to my mind which are the most difficult. The patient is in front of you. You know that something is wrong. How do you convey this to the patient? For that, you have to realize that when you see something on an image, the image is irrelevant. It's always the patient behind the image that comes to you, because if there are no patients, there are no images, there are no radiologists, we can go and sell apples on the road. Unless we have this concept every single time, ask the patient to starve overnight. Do you know how difficult it is to keep a 2-month-old child starve overnight when all that you need is 4 hours starvation? We don't think twice about that. So this has to be drummed into him on first day, first show. Think of the patient as your own to the extent possible, and then you have some sense of what is right and what is wrong. And I would always, always encourage them, go see the patient, go see the patient, go see the patient. I cannot forget my first day in radiology. I had done a year's job at orthopedics, and then I came to radiology for complicated reasons because I couldn't get any other postgraduate education. I didn't get orthopedics, I could not get neurosurgery, I could not get general surgery. And somebody who was playing basketball with me met me outside the dean's office in the Lido. You know what's Lido? Lavatory in front of the dean's office. Vinod Mittal. Vinod Mittal said, Ravi, तेरे को कुछ मिलता है ना तो radiology कर, full time pass है. And that's how I came into radiology. But why I became what I became, and I think I have some sense of interest in radiology, are two people. Both of them are here. Pramod Phadke, stand up. Show your hands. He was my registrar. And he, what shall I say, without talking, led by example of doing things in a way that were in the best interest of patient. Dr. Malini Nadkarni, she was at the head of the top, and she did things again without saying. The thing is that I had teachers who led by example. And there can be no better way of teaching except lead by example. So I take every opportunity to tell them, go see the patient, go see the patient, go see the patient. Get follow-up, get follow-up, follow-up. If you don't have follow-up, you're not learning anything. So this happens then, and then they do all of these things again on patients. You can't do procedures. You can't tell patients, kapra utaro chalo ultrasound karne ka. It doesn't happen like that. There's a way of doing it. And that too, this too, we learned from our teachers who were specialists in interventional radiology, and we just watched them do things and we learn. So this has to be again passed on from generation to generation, and that's one of the greatest joy of teaching, that you have learned something the hard way and you can convey it to the next generation in few minutes. You have short-circuited their 15 years of learning to 2 minutes because you have gone through that. So there is great joy in passing on this information to the next one. And I, this is my pet question. I show them this board and tell them, where is it in KEM? How many of you know? Anyway, doesn't matter. Now, this is again teachers. Dr. Manu Kothari, who have take his lectures and talk about William Osler, William Osler, William Osler. He's my hero in medicine now, in the sense that all that he has done in his day, the father of modern medicine, and all that he has written in terms of such quotations are so true. So this is another example. You cannot study medicine without patients. And ma'am, I was just talking about our students not going to the ward, not seeing patients. How is it possible? In KEM, that's happening. Yeah, they're starting MCQ. I mean, it's our fault. We have made them like that. And we cannot blame them. And somehow we have to get them out of that mode, because I always tell them, your days on MCQ are over now, finish. There is no other no other entrance that you have to learn. Now come to routine, real life as a physician, rather than go through MCQs. The other thing that I do, and I don't think there are many crazy people in the campus who do that, I tell them to do things which are beyond medicine. It's important because you're dealing with human beings, and medicine is not just textbooks. It's not AI will do everything now. What AI cannot do, at least in the near future, is taking care of patients in the sense of their emotional needs. To be able to do that, you have to think. So this is my favorite, and it's a favorite homework for all of you. Google the pale blue dot. Read all that you want. It's an open big thing. And send me a small one-page essay at raviramakantan@gmail.com and what that reading has done to you. You can read all that you want about the pale blue dot. And when you think about that, it sort of stirs up something in your mind, because one of the Bachus wrote me this. And she said, this is the first time after leaving school that I'm reflecting on something. There's a huge difference between thinking on something and reflecting on something. And many Bachus have written other things saying that they all answered this pale blue dot. And anybody who comes to my house, I say, pale blue dot, pale blue dot, send me an email. 20 people come, 1 cent. Let me see what happens here. Anyway. The other thing about radiology is about follow-up. Without follow-up, we are dead. You can call it anything, anything. If you're not sure that it is right, you have not learned anything. And even if it is wrong, you have learned something. So that whole thing translates into feedback. Now I'm talking of teaching. In teaching, you need to have feedback from Bachulo. Otherwise, you don't know. I mean, I give this example. You make the best possible payasam. You know what is payasam? Kheer. And then you tell the people, give, take. The only way you know that it is good is from the people who are eating it and tell you honestly that it's good or bad. Early morning, all of you have taken feedback in the morning. You go in front of the mirror, do this. That's feedback. Without feedback, we will all perish. Therefore, at the end of this lecture, you'll get a small slip which asks for feedback. It will take you exactly 10 seconds to fill. Please fill that set and drop it somewhere. You can give it an anonymous thing. So I don't want to know who said what, except that I want to know something about this particular lecture. Without feedback, we will all perish. Sometimes with feedback, we all perish. So this is a, Deshi will remember this. Is he here? Where are you? Yeah, there, yeah. So this is a pair of lockers on the one on the left side I used to use for a long time, all my time in KEM. One morning, I come and I see something written on the locker. Actually, it was a card. This is a thing I had made afterward because I didn't have the original one. And this thing said this, because I said feedback. And then it was signed SK. I knew who had done this. There's only one person in the department who has the courage to tell it as it is. So I watched the thing, I smiled to myself, and I was walking out, and then I ran into SK. So SK said, "Sir, you saw your locker?" I said, "Yes, I saw your locker." "Sir, did you like it?" I said, "Today is Friday. Tomorrow we will have the Saturday meeting. I will show you if I liked it or not." So this is important. You should be willing to take criticism. Without that, this is what I said. Listen. If you are a radiologist, you have to listen. You have to listen to your patients, you have to listen to your colleagues, the most important thing is to listen to the referring physicians. If you don't get feedback from them, again, you're not running a good department. At least listen, and you may be able to change things, you may not be able to change things. This is all about Bachulog. But education involves teachers, unfortunately. And this is what happens with teachers. So when I tell them, please take a class, Manish, listening, please take a class, you said, yeah, this is what I get. What? You want me to teach? Then something like happened. I do not know how to teach. Can you believe it? The same person who was sitting with his bachu in 3rd standard and teaching him how to multiply, is saying, I don't know how to teach. What is that supposed to mean? I'm scared. This is another thing. Sir, I'm scared. I mean, there are at least 2 or 3 people I know who have said, I'm scared of teaching. To 20 people, come on. You have to start sometime. And this is something that gets my goat. I am not a university teacher. Why should I teach? I feel like telling them, go to the 13th floor and jump. Only time I tell teachers, and most time I tell students to go and jump. And this is another thing. This is not a teaching hospital. Why should I teach? And the last one is something that we have to talk about. No one taught us. Why should we teach? And the example that comes to my mind is Seldinger's technique of catheterization. So I don't know how many of you are in. Suyash, you read? Where is he? You know what he said? He said, I had a needle, a guide wire, and in a catheter in my hand. And in a rare moment of inspiration, it struck me the correct way to put one after the other. This is what Seldinger said. And then somebody asked him, you are going to patent this, no? And he said, no, I'm not going to patent it. And said, you are not going to do it? This is Switzerland. No, no. He said, why? I'm not going to patent it because more lives will be saved. This is what Seldinger himself said. Now, if somebody says, I will not do this. Somebody said bronchial artery embolization. We will not teach you. We started vertebroplasty. We will not teach you. Then there is no medicine. Medicine has come from one generation to another generation. And whether you are a teacher or not, whether you can teach or not, you should want to do this. You should want the next generation to benefit from your own mistakes. And teaching is great fun. Because while teaching, you learn. There's only one person in this hall. Again, I'm referring to Manish because he has courage. So there was a lecture, clinic I was taking, and I said something about what happens to pleural lesions in frontal view and pleural lesions in lateral view, so on and so forth. The next class, in the same class, he comes, quietly bolne ka na nahi. Sir, what you said last time is wrong. It is the other way around. But that is extremely important feedback. That what you did was wrong. And I don't have a slide for that, but William Osler said this. Gentlemen, I have a confession to make. A gentleman is interesting, 1880s, no lady students, right? Gentlemen, I have a confession to make. Half of what we have taught you is in error. Furthermore, we can't tell you which half. This is Sir William Osler, the father of modern medicine. And if we can make mistakes, all of us can make mistakes. We should be open to accept mistakes, not punish bachu log. How can you do that? How dare you do that? That is rubbish. Every feedback that they give is for us to improve or for them to improve. And I insist on this. And some of you who attended Saturday meetings know this, that if I have said something wrong and you find out that I have said something wrong, you come to the next Saturday meeting and tell in front of everybody that's what sir said is wrong. 2 things happen. 1, I learn. And 2, the other bachu log don't go away with the wrong impression. It's important. And I know, unfortunately, not all teachers are completely open like this and they can take criticism, because criticism is a way you can improve. And I talked about George Wald and inspiring. And one of the things that teachers have to do, one of the things that teachers have to do now, with AI there, I mean, there was a time I was taking undergraduate lectures and I asked Bachu log, what is it in medicine that you need to be taught? So they would complain, sir, log aate hain, PowerPoint दिखाते हैं, कुछ मजा नहीं आता है. And 3 batches said the only thing that we need to be taught, I'm talking of theory classes, is biostatistics. Others we can learn on our own. So what teachers need to do is like what you do to need to the patient now with AI is something different from what you are doing so far. What you do need to do now is to inspire them to go to the best that they are capable of. Listen to Nobel laureates. Now that the Nobel prizes are being allowed, there will be a lady interviewing all of them, an extremely articulate lady who is very efficient in interviewing Nobel laureates. Most of them will say that it is inspiration that has pushed us towards finding what we found. It's inspiration. It's not that we will get Nobel Prize, nothing like that. So to be able to inspire your students is the best thing that you can do. Inspire them to be capable of or doing whatever that they are capable of. Now, time goes by. I mean, they are 1 year, 2 years, 3 years, you don't even notice them. One of the things I tell Bachu log on the first day is that you will be with us for 3 years. At the end of 3 years, maybe I'll recognize you on the corridor. I probably will never know your name. I mean, that's my temporal lobe. It was like that so bad. Then, now it's gone case, full gone case. So, time goes by, and some of them will go out. Most of them will go out. Few stay back. And when they go out, I think of what they have done. I've seen this year after year, 25, 30 years now, and they come and they go. But the important thing is that when they leave, each one of them, each one of the Bachu log will leave something behind of his or her personality or something that they've done in the department. There are people who have done stuff in the department which is unique. Someone started the grand teaching file thing. Most of them will leave something behind for all of us to savor and cherish. That is great fun. Some have done new procedures. Some have done a great deal of teaching. Pramod started the whole teaching file concept of keeping folders in the department. I mean, everyone in some way or the other will contribute. When they leave, 2 things happen. They will come, sir, today is my last day, I'm leaving. Thank you. Most will do that, but some will come and cry on your shoulder. That is the time when you need to take care of them. Sir, we don't know, all sorts of things. Personal problem, professional problem, love affairs, all sorts of. I used to stay in the campus, and therefore it's easy for them to come for residents to come home. And I asked Preeti to stay because she can counsel as a woman to lady residents. So it's all possible. It's a part of your job. You are their parents away from home. And the reasons I told you, that because they have no one else here to take care of them. Now, what happens now is that when they go out, there's something for you to be extremely proud of because they will walk on the sands of time, take steps which are larger, deeper, farther than what you could ever have done. You're still in the department, playing with sand, trying to make mountains and tunnels, but they have gone far, far away from you. Reaching in this hall, there are at least half a dozen people who have done this, overtaken me, and gone here and there and made a name for themselves. And that is the greatest joy in the life of a teacher. The greatest joy in the life of a teacher is to be completely outshone by a former pupil. That being the greatest joy, if you ask me why I teach, the answer is, where else will I find such splendid company? And then I would want to take you to these 4 lines, which many of you may have heard, but these lines are so much intertwined with learning and teaching between the teacher and the taught that I would go through this one more time. These are now my favorite lines, and for some of you who are enterprising, there is homework. Who said these 4 lines first? It is not Rudyard Kipling. You will see the internet, it is not Rudyard Kipling. It's much more complicated. Dr. Sunil Pandya, the late Dr. Sunil Pandya, who was chief of neurosurgery here, did so much R&D on the internet. And then both of us sat on a Sunday morning and we agreed that the first person who said these 4 lines was somebody else altogether. What are those 4 lines? No written word, no spoken plea can teach our youth what they should be. Not all the books on all the shelves, it's what their teachers are themselves. That is the profound truth of how teaching, learning happens, and why it is such great joy to be a teacher. I would like you all to think about these 4 lines, to reflect on what is not said, not written, between words, between lines, and ponder the profoundness of this one last line. It's what their teachers are themselves. And then it's for each one of you, as teacher or students, to change, to improve, to inspire, to make new beginnings so that this relationship between teacher and student, after 40 years of leaving school, we had a reunion and some 10 teachers had come from our times. And one of the teachers said, the student-teacher bond is eternal. It's so true. Why would some of them come here? Had it not been for that wanting to listen to a teacher of the past. So this is the most important part of our teaching, is to realize that our students are our own material and they will follow what we do with patients, with whatever colleagues, whatever it is. Now, I want you to take out your cameras, if you will please. Take a picture of this. And that photo will minimize to the bottom of your cameras and go to a web page. That web page is on the Department of Radiology website, and it has links to 3 things. One is the TED Talk by Coach Wooden. The second is the full poem of Glennis Harman about they asked me why I teach and what I say. And the third thing, and perhaps most important thing for me, is that small 20-page essay on the origin of death by George Ward. That book is phenomenal. I'm sorry, it's not even a book, it's a monograph, small monograph. He says humorous thing. And one of the humorous things he said is so profound is that except for mutations, we would still be all amoebas. And it's so true, right? We criticize mutation, but for that we would all be no change at all. And the last thing that he said was, there's a glorious period in scientific research in the 1940s where the cheapest experimental animal was the medical student. And he goes on with his own way of talking and saying things. So please do these 3 things for me. You would be much richer off. That's why I've taken this effort to make this link permanently available for all of you on the radiology website. So you can go through them and think about whether they mean anything to you at all. End of slideshow. Thank you. As I said, there is a feedback form somewhere. Where is Harshita? Where is the feedback form? Just give it to everybody, no? Just pass it around. Please fill that feedback form because it is helpful to me. That's all. It's a very selfish interest. It's anonymous, so you can write what, there's a small space for writing something else. So just write what you want and leave it behind somewhere on the outside of the MLT so we can collect it. If there are questions, I'm happy to answer them. The interesting thing is that when I give lectures like that, all Buddha-wala philosophical lectures, no, there are no questions. That's the best part of it. Chalo, then we will end, ma'am. Shall we end? Do you want to say something to Bachulok? The dean, yeah.
First of all, thanks a lot for your excellent talk, though I missed some part of it. And I think teachers like Ravi really tell us what we should be with our students. And apart from the doing this neat PGs, you all should make sure that you are there with these teachers to learn the years of experience what they have. And that years of experience never comes from books alone. It comes from the practical, seeing patients, seeing in the wards, talking to relatives, talking to students, talking to nurse, to ward boy. So those practical things are learned only when you have a close association with your teachers. And I think that's what is a real message which I would also like to give. That spend time more in the wards, more with patients, even as a radiologist, make sure that you follow up of the report which you are given, whether really turned out to be a carcinoma or no. So whether you were correct or no. So I think that requires a double help, I mean double work, but definitely only then you become a good clinician, and then you become a good radiologist, and you also become a good teacher and good human being. Thank you.
Like to ask Hemangini ma'am to please give the vote of thanks.
You want to say something, ma'am? Okay, fine. Oh. Okay, tomorrow is fine. Day after tomorrow. Finish off now, I have to go.
So I want to thank sir, of course, and Dean madam for forgiving my all stupidity things which I keep stupid things I keep doing. Thank you, ma'am, and sorry, ma'am, again for overlooking so many things. And yeah, thank you, sir. Thank you very much.
So we'll meet on Saturday at 2 o'clock. Most of us will meet on Saturday at 2 o'clock. Desai, sir, don't be late. Okay, I told you. Chalo. Because I'm going to speak on you by name on that day. Full. सबका फिरकी लेने वाला है.
I remember neuroradiology.
Yeah.
They're very interesting.
The full gang was there. Okay, I think we are done. Can we leave? Yeah, okay, fine. Thank you very much. Yeah, of course, you don't have to say, I smell coffee.